Today, joining us on the Fabrycast is Dr. Seema Kanwal, a naturopathic practitioner, board member of the Canadian Fabry Association, and someone who is deeply passionate about guiding individuals towards optimal health. Welcome, Dr. Kanwal. Thanks for being here today.
Thank you so much, Julia, for having me and for allowing this stage to continue. I've really enjoyed the other podcast so far.
Thank you. I've had the pleasure of knowing you, Dr. Conwell, for quite a few years now, and I've seen firsthand how many patients you have helped. I think seeking insight from a naturopath is important because, as we know, Fabry affects a lot of different parts of our body. And we have our Fabry specialists who work with us on these areas. And if we can include a naturopath in our circle of care as well, we can support our body in other areas that may also need attention. Naturopathic medicine and Western medicine can complement each other beautifully, but this can be a delicate balance sometimes. So that's why it's important to always check in with your Fabry specialist before changing or adding anything to your health routine. One of the reasons I love this topic and think it's so important is because Fabry symptoms can be difficult enough. But if there are other things going on in the body that we can address, then this helps lighten that burden. It could, for example, lead to things like better sleep quality, having more energy, pain management, and then this leading to a better quality of life. So, Dr. Conwell, let's dive into this episode on Fabry Care with a functional perspective.
Excellent. Let's do this.
All right. Can you share with us how you got involved in the Fabry space and about your experience working with Fabry patients?
Absolutely. So, roughly 10 years ago, one of my good friends had a friend who had Fabry disease. And he had said to me, "Hey, do you know anything about this?" And I'm like, "No, never even heard of it." And so it was through this particular person that he allowed me to learn so much about Fabry disease itself. And then I got to learn how to actually help him outside of his specialist, like outside of his enzyme replacement therapy, how to give him that better quality of life through lifestyle, through nutrition, through stress management. This gentleman had diarrhea, which we know is very, very common, about 20 times a day. He literally could not leave the house, and nor could he have a normal work. Actually, he had to work from home, and this is way before, days that working from home was even a thing.
Right.
And so, through him and through his allowance and my excitement about learning something completely new that I'd never even learned about in school. We have one class on rare genetic diseases, and that's it. That's nothing, absolutely nothing. And so he allowed me to literally practice on him and learn. And through that, that's how I got connected with the Fabry community. And I got to meet you many years ago.
Amazing. And you always give such an exceptional talk at our meetings. When you're speaking, everyone is captivated because you're sharing practical insights that they can implement immediately. Um, that's probably the best kind of takeaway when you're at a meeting and you're listening and you're thinking, I can do this when I walk out of this room.
Exactly.
So let's talk about what would you say some of these big takeaways are that you share that you know that patients are looking so forward to hearing when you're up there talking.
One of the biggest things we talk about is gut health. We talk about, I get asked throughout my years has always been, how do I recorrect my microbiome? What can I possibly do? So how I think I like to explain this is that when we think about our microbiome, think about the foundation in a home. Would you buy a home that doesn't have a solid foundation? Of course not, right? So the microbiome is the foundation of one's health, whether you have a rare disease or not. And so as you go through life, you're going to experience little as well as big disruptions. That creates cracks in the foundation. So think about that as your ecosystem. An imbalance of the microbial ecosystem is what I've seen with Fabry patients cause that even further inflammation, those byproducts that enter the circulation and activate that immune system. Earthquakes create cracks in a foundation. So that's how I chalk up as microbial disruption. So one of the things that's come up often with Fabry patients is, what are some of the causes of this? Is
Yeah.
it the Fabry, or is it actually something else that we're doing? So genes, we've always said genes will load a gun, but it's our environment that'll pull the trigger. So it's not just that one GB3 gene that we have to look at. We have to look at what are the other things. So this is where then we look at a patient's medications. Are they drinking alcohol? How much are they drinking? Or do they smoke? Traveling. But stress is probably the number one thing. When you have a rare disease, that stress that I've seen people feel, and the depression, the mood instability that has come up has been the biggest area where we have been able to really help people with Fabry disease, look at things a little bit from a different avenue.
I like these. I like all of this because we talk about all of these different areas of the body. But when you're thinking of your day-to-day, your everyday life, it's these lifestyle changes that we can implement that make a big difference
Absolutely.
in your quality of life. So, you have some really good, like, just quick tips. Um, what are those for patients? What are some things that we can implement and start doing today that would maybe make or some lifestyle changes that would make our lives um, we can feel better, feel healthier. What are some of those things?
The first thing I often tell people is, when the sun rises, I want you to get out.
Mhm.
Just
Love
even
it.
thinking, especially because there's so much insomnia with Fabry patients, or there's a disruption of sleep quality. So, in order to try to correct that circadian rhythm without looking at enzyme replacement therapy, without looking at antidepressants, all those are very important, clearly, but simple things. So, I do like a little daily checklist that I often give to people. Number one being, when sun rises, get outside. Second thing, UVA light. Now, depending where you live in the world, if it's freezing cold, the last thing you want to do is get outside. So bundle up and literally go. And if you're in a lot of pain and there's not a chance you're going to go for a walk, so then what I often suggest is bundle up, go out, take a chair on your porch, on the grass, anywhere where you're going to be able to bundle up and just sit and look up at the sky. That UVA light really helps to reset our brain biochemistry, which ultimately will lift our spirit. Third thing is breakfast. Try to make sure that you're within about an hour of waking up in the morning. Have adequate amount of clean protein first thing, because when you think about sleep, you've now had an overnight fast through liquids, through water and food. So within the first hour that you wake up, drink a nice big glass of warm water and have some form of high quality protein. Those are the
And
top
a
three.
protein like eggs. What other proteins would you suggest?
So I like to get, depending on if you're plant based, or if you are eating animal protein or what have you. Eggs are one of my favorite sources because they're a complete protein. And that is when you keep the yellow and the white together. Organic breakfast sausages can be a very good option, especially, but just make sure you look at the label and there's no sugars added into that. Some people don't like meat and they like to have something different. So if you want more plant based, then I usually tell suggestions are to look at maybe something like a healthy fat, like an avocado, adding hemp seeds to that for your plant protein. If you like tofu, and for example, you can make a tofu scramble. Those are all, some ideas for protein sources.
You said a word earlier, inflammation. And on our previous podcast, this has come up a few times that we're learning that Fabry patients do have a lot of inflammation.
Yes.
Um, this is kind of a buzzword right now, and that we do see this a lot in the health space. So inflammation, there is an anti-inflammatory diet, but what are some of those things that maybe you could suggest for patients to do to just help our body cope with that inflammation better?
So there's a few things. Number one, I would say look at what you're consuming every day, not just food. I'm talking about news. I'm talking about stress. I'm talking about the home environment, the work environment. What am I consuming that has the potential to cause that level of anxiety for me to climb up? When we have an increased level of cortisol, which is the stress, That is typically what I've seen with Fabry patients really facilitate that systemic inflammatory response. And when we're looking at those pro-inflammatory states, I've seen where interleukin 6 is it's a known inflammation marker in Fabry disease, and that activates our hypothalamus pituitary adrenal axis. And over time, this will downregulate our body's production of serotonin. Serotonin is one of our key happy hormones in our hippocampus that's secreted. And if we downregulate that, we then in Fabry will downregulate something called BDNF, which is brain derived neurotrophic factor. That expression leads us to more susceptibility to depression and much higher inflammation. Inflammation, though, can be seen in different ways with Fabry. For some patients, it's constipation. Some it's diarrhea. Some it's the pain. Some it's the insomnia factor. So, what are some of the things that people can do is really slow down after you've had a busy day. Just stop. But there's certain foods that will really also be very helpful. I find berries to be one of the most helpful when it comes to helping reduce that inflammatory response with Fabry patients. So blackberries are great, raspberries are great, and if you are in a colder climate and they're harder to come by, a frozen organic option is always there. Certain seeds like chia seeds and flax seeds are very helpful as that fiber source. Um,
Okay.
Other veggies such as asparagus, leeks. Leeks are from the onion family. Very nice and anti-inflammatory foods as well.
And something you always say at our conferences is when you're speaking about diets, a lot of people are asking about the latest diet that's going on right now.
Yes.
What would your advice be, to make sure that we're all keeping a balanced lifestyle and diet?
You have to figure out what works for you. With Fabry, kidney function is a big thing. So if you're somebody who has a lower kidney function and maybe your GFR is not where it should be, doing something like the ketogenic diet might not be the best thing because that's very, very high in protein. So, and I find some female Fabry patients they're wanting to cut out carbohydrates because they feel that's not working for them. You have to remember, yes, you may have Fabry, but you're still a female and you still have
Mhm.
the hormone progesterone. Progesterone needs carbohydrates. So if you're still a female Fabry person who is still cycling, that week before your cycle, you have to feed progesterone, meaning progesterone needs carbohydrates, meaning you cannot do no carbs pre. Otherwise, then, mood instability can be even worse than it would normally have been. I don't know if that's answering your question.
Yeah, that does make sense. And fasting then is also a pretty trendy thing right now.
Very much so.
I know that we've spoken about this before, and I think you do a really great job of explaining the importance of fasting, but also the importance of when to fast and maybe how to do that.
So if you're somebody who has potentially blood sugar imbalances, so you will know that yourself if either through blood work or let's
Mhm.
say even through if you let's say someone that doesn't eat for an hour and then you're really jittery or you get hangry, like as the term is, then maybe
Yeah.
fasting is not the best thing for you. Certain people do great with fasts. Certain people do not. So we have to figure out for that individual. But my cardinal rule of thumb is dinner should be at least 3 hours before bed. So you don't want to eat something close to dinner because then you're going to disrupt your sleep balances. The second part of that, doing an overnight fast of about 12 hours is ideal for a lot of people because that will help to reduce that inflammatory response, sorry, with Fabry pain especially. So if you finish dinner at 6, for example, don't eat
Okay.
again until after 6 the next day. However, now being a man is different. For the male Fabry population, doing a little bit longer fast actually does support, and we've seen this in multiple different patients so far, where it's actually helped that pain management, helped that anti-inflammatory component be stronger. So for men, overnight fast of anywhere from 12 to 16 hours can be very helpful. So then you don't have to follow that rule of having, protein within an hour. Females, it gets a little bit trickier. For some females, they can go 12 hours, no issue. Some can even go as long as 14 hours. So let's say you finish dinner at 6, have your protein by 8 a.m. then the next day. But for some, doing a little bit longer can, but we have to look at what your cycle is actually doing. Estrogen loves fasting, progesterone does not. So if you're in that first half of a female cycling Fabry person, doing a little bit of extra fasting, 12 to 16, may not be such a bad thing. But the key for women is do not do the same thing twice, 2 days in a row. You have to, in order to keep the metabolism and inflammation cascade low, you always want to change the amount of fast that you do daily. So one day do 12, one day do 16, another day do 14, another day don't do like anywhere close to 13 even, if that makes sense.
That's great. Yeah, I think that's great to know. And really important as, all of these different, there's always going to be something new that's happening. And we're hearing about it on Instagram or TikTok or anything that's kind of, up and coming. But probably the most important thing is to listen to your body, right?
Always.
Listen to your body because and you got to tune in to how you're feeling. Also, I think it's very important to, touch base with your physician and get a naturopath on board too, because we can learn so much about our body, the way we're feeling, and under the guidance of both is so important to really have a good understanding of
Always.
what's going on.
Yes, you wouldn't
Probiotics.
come to anything new without speaking to whoever your providers are that are, taking care of you on a regular basis, your nurses, your physicians, whoever those people are in your corner.
Absolutely. Absolutely. Now, probiotics come up in some of our meetings. Um, is there certain strains that you would suggest for Fabry patients?
You want to look at more shelf stable probiotics than anything. Than if something is in the fridge, the chances of that actually helping a Fabry patient is going to be a lot less. So you want to ensure that if you are going to try a any type of probiotic, that you're looking at ones that are good outside and potentially ones that even may have a digestive enzyme component to them. If you are struggling at all with any type of GI stuff, then maybe even an enzyme would be most beneficial. But specific strains you're looking at likely are Lactobacillus acidophilus. Plantarum, I find, is one of the better ones for Fabry patients, especially if there's heart stuff going on at the same time, cholesterol, any issues. Lactobacillus plantarum is the one that has actually been shown to help modulate that oxidized LDL that's often known as the bad cholesterol and really help support HDL even if you're on a statin. Those are two that actually work very well together.
That's great. And for other supplements, once again, we do want to mention that before starting anything new in your health routine, to touch base with your physician. But when we're speaking about supplements, there's a lot of first of all, there's different ones, there's different brands out there. So I want to briefly ask your expertise about maybe some brands, but also what have you seen that's impacted the lives of Fabry patients that could, we can incorporate to our supplement regimen if we have one.
Yeah, so the supplements is always a tricky topic because it's very individual for everybody. And like Julia said, you please don't start anything without actually consulting somebody who's in your corner and knows your blood work and what have you. But vitamin D, we all know for Fabry community how critical that is. But
Hmm.
different forms is tons of that stuff is out there. So there's liquid Ds, there's capsule Ds, depending on what your requirement is and the amount that you specifically need. So it is. I do like to see vitamin D levels for patients first before we even go ahead on that part of it to ensure that the amount that you're going to be prescribed is the amount that you actually need. So there are, yeah, absolutely. There's tons of different, brands and stuff out there. We will have a link to, full script for Fabry specifically. That there's a few options. I'm not affiliated with any of these guys, but Thorne makes a very clean brand, especially if you have any type of food allergy, like if you're allergic to peanuts. A lot of vitamin D liquids, unfortunately, are in a peanut base. So a lot of patients don't know that, but that's something to be very cognizant of. Another supplement I think is important for depending on if you have what the heart is actually doing is something called coenzyme Q10 or cytoubiquinol. CoQ10 is think about, our heart is the most metabolically active organ that we have. And if something's happening in the gut, it's going to be impacting the heart. So if we think about, differentiation in utero, when a baby's first developing, the gut is the first organ to develop, then hours later is the heart. So of course those two are very directly connected, as you can see in the Fabry community. If there's any, heart stuff that's going on, CoQ10 is that ignition switch for that mitochondria. So especially if you're on a statin, statins are known to drop a person's CoQ10 levels, and that's something important for heart function. So that is one. Another one I think I like a lot is fish oils. I'd like you to get fish from actual fish, but if let's say you live in a region where that may not be possible, then a high quality fish oil, whether it be liquid, whether it be a capsule version, even, those are an excellent source, and always a good multi. Depending if you're a man or a woman, you want to be mindful if there's any iron in there. If you're a man, you want to make sure that the multi that you do have maybe does not have the iron in it. And then depending on your levels, of course. And then for females, I usually suggest one with iron in it.
Okay, so we will put this in the show notes,
Yeah.
a link to full script, and patients will be able to log on and see your recommendations.
Yeah, there's lots of different options. You do not buy everything, of course, but there's a liquid option, there's a capsule version. There's all these different options there for that people can take a look at.
Wonderful. That's amazing. Thank you for that. And like you said, know your numbers, get your numbers tested for vitamin D, and you can have that baseline, but also then you're not blindly supplementing.
Exactly.
You know how much you need to take. Yeah.
Especially with vitamin D, because vitamin D is a fat soluble nutrient, which means it does build up in our fat stores. But that also means that it's important to take breaks from it. So in the summertime, hopefully you live in a place where you do get sunshine. Then you would actually be taking breaks from it. And I often say, if you go on vacation and you're going to Mexico, I don't know, you're going to Hawaii, wherever you're going, and it's going to be sunny there, maybe don't take them with you. Just take a break. I think it's important to take breaks from supplements as well.
Okay, perfect. So this is what I've learned so far. So you wake up, go outside in the morning, get some
Yeah.
sunlight,
Yes.
check your numbers, and incorporate a naturopath into your circle of care and get your numbers checked, and you know where you're at. There's some things that we can do. There's some great things that we can do to help, balance out our mood, our sleep. Is there any sort of other lifestyle recommendations that you would like to share before stepping off?
We talked about sunrise. We talked about UVA light, so making sure you get at least 5 minutes, eating breakfast, high quality protein. Maybe one more thing for Fabry patients I like to see is no snacks in the middle. So, when we're stabilizing our blood sugars, we're learning how to balance our leptin levels, having at least 3 to 4 hours between each meal is ideal. It also always depends on the individual. Try to have at least 30 minutes of outdoor time, whatever that looks like in your life. And if you're just in too much pain and you're thinking, there's not a chance I'm going to be getting outside, that's okay too. Be gentle with yourself. Wrap up and even just go sit outside on a lawn chair. It's okay. Don't force yourself, but at the same time, push yourself a little bit, because you are your own entity, your own energy. You know what's going to be working best for you in that moment and that day. The last thing is, drink your water. Start your day with that warm glass of water, nothing cold, because when you've been, overnight fasting, you're now going to be dehydrated first thing in the morning. And with Fabry, that's already a risk for your heart and for your kidneys, is that dehydration aspect. So when you start your day with warm water, you're now going to allow dilation. Cold, remember, is constriction. Warm is dilation. So we want dilation first thing in the morning to help us absorb that liquid that we're having and actually hydrate our body. Last thing is eat organic as much as your budget will allow. If you're not able to, that's okay too. Environmental Working Group puts out, every July, I believe it is, every summer, they put out the top list of the top, clean 15 it's called, and the dirty dozen. Those dirty 12 things are what you want to do as organic as possible. And the clean 15 is known as a list that doesn't have to be organic. So avocados, for instance, doesn't have to be organic. Something like berries, however, you want to ensure that they are as organic as possible.
Wonderful. I remember this is a few years back, but I was in the early days of having a newborn, and I called you, and I was feeling, I think, just really overwhelmed. And you were like, just do you have time to go outside and maybe for 10 minutes? And I was like, oof, I don't know if I do have 10 minutes right now, but you're like, that's okay. Find five, go outside for 5 minutes and just breathe and take some breaths. And I remember what I loved so much about that wasn't so much, I thought what you said was great and I did do it. But what I loved the most is that you're always willing to work with people. Whatever they can do is enough. Whatever they can do is, and that's what I think is so great about when you're talking and when you're in the presence of all of patients who are feeling, overwhelmed or stressed and have all these symptoms. And it's really hard to try to figure out, what symptom. It's kind of like whatever you're feeling the biggest at that time is what you want to bring forth and help yourself with, right? And
Absolutely.
you do such a good job of just helping them in the moment, which is so, so, so important because that's when you need it the most. And you're always willing to work within, whether it's diet. Someone says, I don't eat vegetables. Okay, that's okay. So let's focus on what you do eat, and we'll make that work for you. So we like to end our podcast with one final tip you would like every patient listening to know. You already said quite a few tips, but is there a final tip you want to let people know about?
Just breathe. No matter what, you have so many people that are caring about you and that love you, and you will get through. There are days that you're going to think, how the hell am I? Just trust your own intuition. We all have that innate ability in our own body's energetic field. Imagine that. Imagine being surrounded by a bubble. And if you don't want to talk to anybody that day, don't. But you're not allowed to do that 2 days in a row. Only one day.
I love that. I love that, Seema. Whether it's through nutrition or lifestyle modifications, you always empower those listening to pursue their own wellness. And there's a lot of power in that. So thank you for being part of this community, and thanks for being you.
Thank you, and to all of you for even allowing me to have this ability to even learn. I've learned so much, Julia, just from you and your health challenges and the amount that you have endured and how far you've come. It's an honor to be in your presence, truly.
Thank you.